Your lymphatic system is important because it fights bacteria and infection in our bodies, helps with tissue drainage, transports fat throughout the body. It is made up of lymph nodes, lymphatic vessels, and lymphatic fluid. Lymphatic vessels are tiny tubes, like your blood vessels, that carry fluid to and from your lymph nodes. Lymph nodes are small bean-shaped glands located along your lymphatic vessels. Your lymph nodes filter your lymphatic fluid, taking out bacteria, viruses, cancer cells, and other waste products. Lymphatic fluid is the clear fluid that travels through your lymphatic system. It carries cells that help fight infections and other diseases. Sometimes, removing lymph nodes or receiving radiation can make it hard for your lymphatic system to drain properly. If this happens, lymphatic fluid can build up in the area where the lymph nodes were removed. This extra fluid causes swelling, called lymphedema. Lymphedema can be caused by cancer, surgery to remove lymph nodes, radiation, or infection related to cancer. A person can develop lymphedema on the side of the body where your lymph nodes were removed. That can include in the arm, hand, leg, breast, or torso. To minimize the risk of lymphedema, early treatment is important. Look for changes no matter how small. Changes can be in the size, shape, or skin color of the affected area. They can include swelling of part or all of the arm or leg, including fingers or toes, a feeling of heaviness or tightness, restricted range of motion, recurring infections which can appear as redness or swelling with pain, or hardening and thickening of the skin. To help reduce the risk of lymphedema, discuss with your surgeon the reason for lymph node removal and techniques that minimize lymphedema risk. Ask your doctor about SOZO measurements. SOZO is a machine that detects fluid volume change. It can identify lymphedema very early before swelling occurs. In preparation for the measurement, remove all jewelry and your shoes. You will be asked to step on the SOZO scale for 5 seconds, where your measurement will be read and transmitted to the nurse's tablet. The result is written in a booklet and given to you as part of your record so that changes can be monitored over time. Lymphedema can be treated with exercises, the use of compression garments and bandages, and manual lymph drainage. If you should develop lymphedema, your provider may refer you to a physical therapist. Physical therapists are licensed professionals who work with patients to improve their movement and manage their pain through exercise, hands-on care, and patient education. Lymph drainage is a gentle massage that helps to relieve swelling that happens when medical treatment or illness blocks your lymphatic system. It is usually done by a physical therapist. The following video shows the exercises that can be used to reduce the risk of lymphedema. They can also be used to treat patients with known diagnosis. Your self-care regimen for lymphedema should also include the following: elevate your swollen limb, keep moving, perform exercises, and deep breathing daily. Wear a prescribed compression garment as advised, especially when traveling. You may need to increase your compression grade when flying. Your physical therapist will advise you about this. Avoid trauma, cuts, scratches, and pinpricks due to the risk of contracting an infection. In the instance that you do have an infection, treat it immediately and seek medical attention, as a course of antibiotics may be required. To prevent lymphedema from getting worse, don't wear tight clothing or jewelry, such as a watch, on the affected side. Wear loose-fitting, comfortable clothes. Don't overheat. Avoid hot baths, saunas, spas, tanning beds, sunburn. Don't carry heavy shoulder bags on the affected side. Use the opposite side. Whatever the weather, be sure to cool down after exercising. Avoid wearing insect repellent. Wear gloves when cleaning or gardening. Don't receive heavy kneading massage. Don't perform jobs or activities that cause overloads, such as lifting anything heavy, as this reduces lymphatic flow. Don't ignore even the slightest increase in symptoms. Seek treatment immediately. These are compression garments and bandages that are used to treat lymphedema. If left untreated, lymphedema can get worse. Learning to reduce the risk of lymphedema and getting treatment right away decreases the possibility of infections and complications. Talk to your healthcare provider right away if you notice any of the following symptoms: discomfort, burning, itching, numbness, pins and needles, change in temperature, or indentations from clothing or accessories. We encourage you to always follow up with your provider if you have any concerns about your well-being, and do your best to maintain a healthy lifestyle. Eat well-balanced meals and stay active. These and other positive habits can help you live your best life.